Hello, All-Star clients, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while also having some fun along the way.
Just a little, though.
We had some fun prior to starting the podcast, hence why we have a red-faced veterinary assistant and someone crying in a chair. Okay, so welcome to another episode.
It releases endorphins or oxytocin or something.
Let's not hope oxytocin.
So endorphins.
Okay. Well, because she has
I know. That's right.
Okay.
Too much oxytocin, her baby's going to come out.
I know it. We don't want that.
Okay. Oh, it's me. Sorry, we talked about this. On today's episode, we have myself, co-host and associate veterinarian,
Yo, your country.
Dr. Ashton Duckwall.
Why?
I don't know. I kind of felt it. I just kind of
Go with it.
Room
Okay.
assistant. I can't do it anymore. Abby Depew.
Oh.
And of course, my favorite room assistant. No offense to Abby. Felicia, because she's fine. She's fine. Just fine. Nobody else's.
Somebody stop.
And my co-host, Dr. Emily Maria King.
It is not
Or
Maria. Marie.
Marie.
I'm going to take your microphone away. What?
Nope. I was thinking of the Brooks and Dunn song. Maria.
Oh, that's a good song.
It is a good song.
Yeah.
Wait, doesn't it go really high pitched?
I can't do it. I'm hot.
Yeah, I've got it going in my head now. Now that you've said that.
Oh, Marie. You gotta. It's like we're actual singers. You gotta go in and out on the microphone.
Okay.
Okay.
Great.
How are you guys doing?
Great. How are you?
I'm great.
I'm great.
I had a really busy, good day.
It's a good time.
It's nice when it's busy.
Yeah.
What did you say?
I said I just ate, so I'm
Oh,
good.
you just ate.
Oh, so you're comfortable and happy.
good, yeah.
We're always talking about food and the fact that we're starving when we start the
She
podcast.
gave me a chicken nug, so I'm good.
Oh, I wore pizza socks.
Oh.
Wow, that makes me hungry too.
Yep, that's why I wore them.
Oh my gosh. We're happy to have you guys here.
Yeah.
Thanks for joining
Welcome
us.
to the fun club. The fun zone. The
Funorama.
Splash zone.
splash.
Oh.
Like in a log ride.
Yeah, it could be, or it could be like the Nickelodeon
Ooh, the
slime
slime.
zone. Mm-hmm.
Slime.
It could just come from the ceiling. That'd be cool.
We have so many great ideas. Okay.
So, icebreaker wise, are you ready? Because what we do is ask some icebreaker questions to kind of just,
Loosen up.
loosen up the crowd.
Break the ice.
Break the ice. So, if you could pick one coworker to switch lives with, who would it be?
Oh, wow. I did not prepare for this.
Abby. Who would it be?
She looked at taste.
Well, jokingly, I said Harrison so I could have a new kitchen and have a nice life and 2 dogs.
Ooh.
But then I was like, no, I kind of want to be Pulse. And, Felicia wants to be Pulse too. I don't know. I'll be King. I'll be you. I'd love to be you.
Why?
Because you're great.
Oh, thanks. You're nice.
Oh.
Thanks.
Why did you both choose Pulse?
Her garden.
Oh, yeah. She
I
likes
have
the
no
garden.
green thumb, and I just hear all
She
these great things.
loves plants.
I'm
She
taking care of her
loves
seedlings
plants.
right now.
Yeah, she's so excited. Every time you ask her, she lights up. It's so cute.
I have 2
She loves
plants,
them.
and the only reason why they're still alive is because Austin waters them at home.
So, she's got garden vegetables going? Like, are they
yeah.
starting? Oh, that's
She did a
exciting.
salsa garden this year.
Okay,
And
that's going to be a
lettuce
lot of
and
pressure since you were
flowers.
staying there.
I'm taking care of them. It's a lot of pressure. I'm scared.
I
Not
thought
they're
that
not gonna-
TJ was back.
Tonight.
Oh, it is Tuesday. That's right.
Yeah, I forgot to.
Yeah. So, that's cool. So she starts them from seeds and then she's going to
Yeah.
plant them outside. I'm just too lazy. I just go buy the plant once it's a plant.
I stay
Cindy,
far away.
you've got the land. You need to do the garden.
Yeah.
Charles can do it. I will literally kill all the plants. I'm not a plant person. We are not great at harvesting our duck eggs every day. We let them oh my gosh.
That's
One time in the winter, bless her heart, Scissors is one of our ducks. We had
Scissors, I can just see her legs. Sorry. Egg.
no, we had rock, paper, scissors. R.I.P. to rock and paper. It was very gruesome. And I was outside and I missed it. They got picked up. by hogs.
Okay,
Somebody-
hold on,
Okay.
but what about the duck eggs?
Sorry, yes, thank you for
Sorry,
bringing me
yeah,
back.
mhm.
So in the winter, it's cold out there. We don't spend a lot of time. We just make sure they got food and water and
Right.
run away. So we let the eggs pile up so much. She was nesting on this
On the-
pile of eggs because she thought they were gonna hatch, and I had to look it up because I was like, "What is she doing? She won't even leave to like." Usually she'll come greet us or go eat. It's that they'll sit on them for like 22 hours.
Oh my
Out of
gosh.
the day, they won't eat, they won't drink, they're protecting their nest. And
So you had to get the eggs out of there.
yeah, as
Wow.
fast as possible. We waited till the next day, but as fast as possible. Yeah, it was there's a name for it. Now I forget, but you gotta harvest those eggs quickly.
Okay, so if you have any ducks out there, does the same apply to chickens?
I don't know, but I do know that chickens and ducks eat their own eggs. I watched them eat their own egg. We ran out of food
That
too one time,
oh.
and
You sound like a
one-
great duck owner.
I know.
broke.
You're really
The
selling
duck broke
yourself here
open, and I was just
to all
like,
the, farm stores out there. They're like, don't sell to her.
No, here she comes
only
again.
had-
Here she comes.
a couple lives lost with the ducks, and that's predators. That's nature. That's normal. It's not me.
If Richie was sitting here, he would say, I watched this show called Nature is Metal. And it is like just hardcore where nature is like metal, where the animals, like there's this one video of this duck. No, this monkey
you
on
watch
top
it too?
of a. No, he shows it to me because he's like, I just watch every time. I'm like, I know you watch this episode. I know you watch this. I know you follow this. Every time he goes, like, I watch this thing on Nature is Metal. And then he was like, there's this one where this monkey is on top of a pole and he grabs the bird out of the air and then whacks it on to eat it. Nature is metal.
Wow,
It's vicious out there.
Punk rock.
it's vicious. Sink or swim, people.
It's tough.
Well, how did we get here? What was the question?
Oh, okay. Sorry. Someone else. Yes.
I don't know.
Switching lives. And then we got onto duck eggs. I'm not sure how that happened.
Nature is metal.
Maybe we just move on.
Oh, I asked about pulse. That's how.
Oh, and then we
Okay.
talked about yeah.
Yeah.
Who do you
So
want to switch lives with?
Caleb Marine.
Oh wow, that was fast.
Because he's so like quiet, you don't know anything about him. I'm like, I
No.
wonder what his life is like.
He's hilarious.
So mysterious.
So I know. I would go switch lives with he would not want to be in my life, but
I think it would be fascinating to see a look inside Denise's life.
oh yeah.
I think she'd be
It's
so
like an
it'd be so-
encyclopedia up there.
Yeah.
It's amazing.
Yeah.
All them bugs.
Yeah.
All of them bugs.
Maybe it'll help me get over my fears of spiders too.
Yeah.
You're afraid of spiders?
I hate them.
Yeah, there was one in the bathroom earlier, and Viv actually stepped on it as I was telling Denise that there was. Well, she was on Vocera already, and she came over. She's like, "Nope," and then just walked away. I'm like, "Well, I guess she didn't have to pee that bad."
Because I went to the other one. Okay. What activity helps you relieve stress? Felicia.
Oh gosh, relieve stress. I typically just cry, and then I'm good. So,
That
What's an
releases
activity?
endorphins.
Crying.
Yeah. Sometimes it's a workout.
yeah,
Really cry really hard.
I try really hard to hold it all in, and then all of a sudden it just comes out, and I'm like, "Okay, I'm good now."
Okay.
So,
That's your stress relief.
yeah, I
Yep.
cry.
Once you start, you can't stop. One of those.
Yeah,
I hear you.
I get that.
This is Phyllis, by the way.
Oh yes.
For all
Phyllis
those
is our
watching our podcast, this is my dog,
podcast dog.
our podcast dog.
say
Since
hi?
Quill didn't work out, he didn't make the cut. She's doing
very
okay.
happy.
She's
Oh, I
doing
can't
okay.
hold you.
She likes Felicia's long nails.
Mhm.
Yeah. So does Quill.
So what Abby,
Yeah,
what about you?
Abby.
Stress relief?
Yes.
I don't know. I just cry a lot. No, I'm just kidding.
Oh my gosh. People are gonna think that our lives here are horrible.
We go home and cry. No, I don't know. I like going outside, fresh air. It's a good stress relief.
One too.
And crying.
Still crying.
Yeah, for sure. Me?
Crying?
No. I would say exercise.
I knew I just
You knew that,
you were
didn't
gonna
you?
say that.
Working
Yeah.
out, or I would say vacation.
Yeah.
As an activity. Yes.
Yes. I would say, despite my poor harvesting egg habits, I love being
Poor
outside, working outside.
Yeah.
Like, just
Yeah,
doing
that is
something.
great, isn't it?
And also riding my horse is brushing him, riding him, feeding him, watching him.
Feeding him.
Feeding him.
You're going to feed him.
Scooping some poop.
You're scooping your horse poop?
Somebody has to.
I gotta keep it clean.
Charles
for my
is not
baby.
going to do that.
No, he's made it clear. All my responsibility.
Oh, I'm sorry.
Yep.
No, I love it. I don't care.
Yeah.
It's a good workout.
It is.
Working on the farm. That's my stress relief.
I could see it.
fun.
I could see how that would be stress relief. I love working outside
Come on
too.
out.
I know.
I'd love to have
Come on
ya.
down to the farm.
Oh, thanks.
There's a duck. There's a lot of eggs.
One.
There's
Duck.
3. No, there's 3
Oh,
ducks.
we brought them back.
What?
I
The
thought
2,
that
the
there
R
was
and the
only one.
I.
Oh no,
The
they're
S and the P and the.
they're
oh,
gone.
yeah,
but
those
we
are-
have the OGs, which are banana and fireball.
Speaking of Fireball,
I was just gonna leave that there.
I do say stress relief is whiskey.
Yep.
That would be. But I have to tell
Nice
you
glass
all
of wine.
about this whiskey that is called Screwball.
Yes, great. It's
Have you had it?
delicious. Yeah.
Peanut butter whiskey.
Yep.
Peanut butter infused whiskey.
Mhm.
Combine it with grape juice.
No, just drink it straight.
Combine it with grape juice, and it's peanut butter and jelly, baby.
I saw
Oh,
a
yeah,
TikTok and
baby.
they
I
did
hate
gummy
peanut butter.
bears and soaked them in
That's
gummy
what
bears.
I know. I haven't done that.
You should try.
It's supposed to be like, you don't like peanut butter and
I
jelly.
hate peanut butter and jelly.
Okay, well, you wouldn't like this, but this is freaking amazing. I haven't drinking it by itself.
Okay. You
The
should.
Screwball
It's
by
good.
itself.
It's good.
So, if all you out there, if you're
I'm
a
sure you
whiskey
could
drinkers,
make like a Reese type drink. Mix it with like,
that would be
I
killer.
don't even know. Anything chocolate.
Chocolate liqueur.
Well, Harrison also told me that I'll have to bring Screwball, and we can all try it.
Okay.
I also was informed that you got to have Ben's barbecue, and I did.
Oh
not.
yeah.
You got bins?
Oh yeah. we
After
did.
the last podcast when we discussed Ben's barbecue and gave him
It
a shout
was
out,
bomb.
it was good.
Yep. I ate
I'm
my-
so
it was
disappointed.
So
I
fast.
did not.
Harris was like, "Are you already done?" I was like, "Yeah." It was like 30 seconds down the hatch.
Oh,
it was so
wow.
good. I think I took one breath on the whole thing.
I'm gonna have to try some because I haven't had
Yeah.
a chance. Have you had it,
No.
Felicia?
Not yet.
Okay,
It's good. We should get it.
get it again.
Well, you're on again. Sweet.
Let's go get some more. Okay.
Okay. Case collections. Oh, case collections.
Yes. Case collections.
Kids collections.
Well, we recruited Felicia today. Did you get a case?
Is it the one that you told me about earlier with the question? Right?
Gave her a case?
I didn't give her a case.
There's a lot of
Harrison,
eye
is that what
contact.
that is?
I have
The question
my
you
case.
gave me earlier? Is that? I don't know.
Kenny's the one we just talked about today, earlier? No.
Do the do
Oh, is it like one of those cases where I pick one?
yeah.
Yeah.
Oh, well, no, I didn't.
Do Riggins.
That's what I was thinking.
Yep.
Or I could do the other one that we had today, which was kind of sad, though.
I
That
think
is interesting.
Riggins because now I'm on the edge of my seat.
Okay, Riggins. He is a Basset. I don't know. He's
10-year-old,
9,
like
10
9,
years.
10,
Yeah.
something like that.
He presented for increased drinking and urination. And so that can be multiple things. So we just started with basic labs because his overall exam was unremarkable. And so blood work showed just an increase in calcium, and that was it. And that actually calcium, when it's increased, it can cause increased drinking and peeing. So we went on to further investigate it with a panel that we send to Michigan State, and it kind of breaks down hormone levels and stuff pertaining to calcium. And it showed that it was real, but that was it. I couldn't pull up the attachment today. So you start to worry about essentially cancer, different types of cancers when calcium's just randomly increased like that, especially in an older dog. His anal glands were normal, and that's one area. And so we talked about searching with imaging x-rays. So they took some time and he presented today for coughing and did x-rays and unfortunately found a large mass. Well, yeah, mass in his chest. And we think it's involving the thymus, which then can cause poor regulation of calcium. So we have an answer. It's not ideal, obviously, but it is. I mean, kudos to them for noticing that drastic change. Sometimes it's hard to pick that
Yeah,
up.
it was a large mass in his chest and causing coughing,
Yep.
weight loss, the hypercalcemia.
Mm-hmm.
Yeah, so unfortunate, but like you said, at least we know the answer.
Yes.
Why he's doing what he's doing.
Yes. So sometimes it does take diagnostics to figure it out.
Yeah.
Yes.
A lot, most basically 99% of the
all the time. There are some things.
Exam is a diagnostic, but you can't always.
It is,
there.
but not by. But I mean, we use it a lot. Sometimes, I mean, you do know when in an exam exactly what's wrong with it. You don't need any other diagnostic tools, but sometimes you do.
Yep.
My case is Lily Garrity, because we were talking about her earlier too.
Yeah.
And she is a 1.5-year-old female spayed boxer that presented yesterday for. It was yesterday, right? Yeah.
Fainting.
Yesterday for fainting. Yeah, so she was running around her yard a little bit, but then wasn't running when she was coming in, got to the steps and fell over.
That's scary.
And so, yes, and he was convinced that she died. And so he carried her inside, but then she came back to life. And so probably because she fainted and then,
Yeah, that is scary.
we're having
kind of dog is
arrhythmia. It's a boxer.
Oh.
He's just a baby.
She's just a baby, though. So we submitted her labs and everything was okay. And then we took her chest films and we couldn't really appreciate anything obvious on her chest film. So she is going to the cardiologist for a workup.
Good.
Which to our listeners, boxers, heart disease is like number one.
Yeah, unfortunately. So we think that it's probably an arrhythmia, probably of some sort. I mean, that's where we're kind of, guessing at this point. And then we need to send her to the cardiologist so they can maybe do a Holter monitor or some way of monitoring her rhythm, basically consecutive hours of a day. So see if we can find the arrhythmia.
Yeah.
They'll probably do a cardiac ultrasound, I would think, too.
Yeah.
Don't you think?
Oh, yeah, I would think.
Because that breed's prone to dilated cardiomyopathy, so they're going to look for that, even though our x-rays didn't look very exciting. I'm sure they're going to look for it.
But it's ECG.
Yeah.
You have to do an ECG.
Yep, to find the arrhythmia.
Yep.
So then the question is, can we do something about it? So, but as I was telling the Garrity's, we need to know first what it is before we can answer the question, can we do something about it? So.
Would
To
she
be
continue to
determined.
faint until we know? Like,
She could continue to faint.
that stinks.
Yeah. So I was like, don't run her, leash walk her.
Yeah.
I mean, and keep your fingers crossed.
Yep.
So, but now we're really lucky because we have a cardiologist in town and we didn't used to.
Yeah.
So that's really
nice.
helpful. Very, very helpful in terms
Yes.
of getting patients seen in a timely manner.
Yeah.
So,
Don't have to travel too far.
yeah, absolutely. So those are two cool cases.
Yeah.
Mm-hmm.
Lots of medicine.
Today.
I know.
Something
Just
today.
today. I know.
Just in the past couple of hours.
I know.
There have been
Our
quite a
days
few.
are never boring.
Mm-mm.
Always a problem to solve.
Always a problem to solve.
Absolutely. Okay, so we are on to our client question from Pam Gasway. Hello, vets. My 2-year-old mini golden doodle weighs 16 pounds, and his vet says he's at an ideal weight. I feed him Purina Pro Plan dry food for small breeds, 1 to 1.5 cups daily. He gets treats when doing tricks and practicing. He's got an AKC novice trick dog title, and we're working on the intermediate title. That's cool.
Yeah, that is cool.
He's also an AKC therapy dog, and he gets treats when we do visits, 1 to 2 times per week. I go to Starbucks and Dunkin' weekly. How often is it okay for him to have a pup cup? I know lots of people also indulge their dogs with these treats, and I've read a bit about pancreatitis, which I certainly want to avoid. What's your suggestion to keep my boy healthy? Thanks, Pam.
It's a great question. Also very cool. Trick dogs are so cool to watch. Oh my
I
gosh.
know.
To have the patience to train them to do that is also really cool.
It is very neat.
Yeah.
I wish I could do that with my dogs.
Yeah.
At least like even half of it.
Yeah, I know. Or have the patience to it. Or know where to start. I don't even know where to start.
Yeah.
You can sit and shake. That's it.
I saw the coolest video of a golden retriever, and he was dancing with his owner.
Yeah.
Have you guys seen that to Greece?
Probably.
And the dog was, you okay over there? And he was dancing to Grease, and it was so cool because it's really hard to teach a dog to back up. And so he was backing up. He was going forward. He was going between her legs when she was doing the dancing. It was the most cool. Have you seen that one?
No, I think so.
Oh, it's so cool. I'm like, how did you ever teach this dog to do this?
That'd take hours.
Yeah. Yeah. And it was cool because it was a fun song and the dog was so excited. And it was like, that had to have taken hours of practice and breaking down tiny steps into,
Yeah.
you know what I mean? To get to the whole, it's really cool.
I love the halftime shows at basketball games.
Yeah.
I live for that.
I saw a little chihuahua get up on like 12 chairs, and I'm like, screw the game. I want to watch this dog do all of his tricks. It was amazing.
Yeah.
So what's your guys' opinion about the pup cup?
Thoughts?
Do we have Starbucks users here?
Yes.
No.
Abby's like, daylight. I haven't developed pancreatitis.
That we know of.
So yeah, tell me what you think.
I've never gotten a pup cup because I don't have a dog. So I think it's an interesting concept. I probably would only do like one a week. I feel like every time you go to Starbucks or Dunkin', it'd be a little too much.
Yep.
I mean,
How do you feel?
yeah, I think one a week. I mean, how many times have we had a dog come in here saying that they're sick because they ate the pup cup?
None.
I mean, it's usually
It's something else. It's usually
Yeah.
something more like dramatic. I mean, the amount of
Yeah.
sugar, I get it has, because that's the main ingredient would be the sugar
Right.
content.
Yep. 'Cause
Not
it's whipped
necessarily
cream.
fat, right? So
Right.
sugar content. I mean, sure, the milk source, but
Yeah.
You could always ask too, and don't fill the cup all the way. Like,
they're
fill
Dixie
it
cup size,
halfway.
right? So
Right. I mean, I
Cup,
think
but
that
make
it
it
just
small, please.
it comes down to like your dog's GI tolerability, right? Like it's like if your dog is going to flare up with eating something new, or I mean, it just
yeah.
a pup cup's not like, I mean, let the dog have a pup cup. Let it have whipped cream.
And
like
if he has diarrhea after, probably don't do it
then
again.
avoid it in the
Yes.
future. Like it's not one of those things where it's like don't ever get a dog and start it on pup cups. You know,
Right.
it's not one of those things.
Right.
If a dog's prone to pancreatitis, he's probably got a sensitive gut. Like you don't just get pancreatitis. Well, you can get pancreatitis willy-nilly. The most common time is Thanksgiving. We'll hear that dogs come in because they got into
High fat stuff.
high fat stuff or just new
High sugar.
stuff, and their upset belly can really irritate it. But
Yeah, we have that happen when they get into candy, like
Mm-hmm.
sugar candy, like Sour Patch Kids or something like that. You know, so the sugar content or fat content can trigger pancreatitis. And then we have some breeds that are more prone to pancreatitis, like Schnauzers or
yeah,
white dogs, Malteses.
yep,
Things
Small
like that.
dogs.
Small dogs.
Corgis.
Yeah, exactly.
yeah.
But I think if you're using it wisely and your dog doesn't have a food sensitivity or a food allergy and seems to tolerate it when you use it, and they're not overweight.
Right. That's the
I mean,
other
I guess it
thing.
could be calories in a dog, a 16-pound dog. I mean, a pup cup could be however many calories.
I know I didn't find it when I was looking up how many calories, but I think that's the other thing too, is like, if you're worried about maintaining your dog's weight, then obviously be selective on your treats. Like I always tell owners, if you want that desire of like using a treat to bond with your pet, to teach them, you can still use something they like fruits or veggies. And it's not that high in content of calories, you know, like feed them what they need requirement wise. And then just don't do the elaborate, you know, whatever treats they have now, you know, they have so many treats out there that are high in calories. And so I think that's important. Like she loves apples and bananas. Like she'll do whatever she wants for those. And I mean, apples have some sugar, but it's not going to be like a milk bone probably, you know?
Yeah.
So I think it just depends on the dog's weight, how they can maintain it. Every dog's metabolism is so different. I feel like I see all across the board on dogs that are still fat and they don't get fed.
Right.
That
They're
much.
on a diet, right?
Yeah.
I have one. Yeah, Pickles.
Poor
Pickles.
She does not get fed hardly anything.
She just built different.
That's
it.
Thank you. She is built different.
But I was feeding my dog to be 100 pounds, and he's supposed to be like 70. So he's
nice.
now on a diet.
He is now on a diet.
Yeah.
Oh, gosh. So, yeah, I think treat your dog to a pup cup from time to time.
Yeah. Yeah.
Let him live. Let him enjoy life. Let him enjoy life.
Live forever. So
Yeah, exactly.
But like other things she does for treats, like you could use those times where you could do like bland plain
Cheerios.
Cheerios or marshmallows. Like every time I see someone and we give marshmallows, they're always like astounded that marshmallows are safe and stuff. Like
They're
we
good
use
for
them for
allergies,
food
too.
allergy dogs. Yeah. So I think that's another way if she wants to be mindful of the treats that the dog gets all the time, or even cut down the feedings and just take a pile of kibble, you know, a handful of kibble and use that as a treat. They don't know.
Right.
Yeah. Food's food.
If you get excited about the treat, then they'll just be happy about it.
So I would say weekly easily he can have a pup cup weekly.
Sure.
Weekly.
Especially if he's tolerated up to this point.
Yep. And he's not overweight, then definitely weekly. I think you're okay.
Yeah.
I like it.
Yeah.
We're all in agreement?
Yes.
All in agreement.
Okay.
I like that answer.
I think so.
And he's going to be really happy that we told his mom that he can have the pup cups weekly.
I'm not going to take those away.
Exactly. So, very exciting.
Yeah. Was that it? Did we answer the question? I
We
feel like-
answered, I think we did. We answered her whole question.
How often? Okay.
Yep.
Any other
maybe
questions?
we
Let us
should
know.
maybe we should say what pancreatitis is.
Yeah,
That's
what
a good
is
one.
pancreatitis?
Because it is
I mean,
a
we
weird
talked about, but I mean,
disease.
like, why don't you talk about
Okay.
what is pancreatitis?
So it's basically the pancreas is a cute organ. I think it's so cute when we learn
It looks like a
about it.
boomerang.
Yes, it does. And when you see,
Okay.
anyway, it's cute. And it's in the intestinal tract, and it's surrounded by all like the gut, and so that's why it can get irritated when the gut gets diarrhea and stuff. But it has all these enzymes and releases those to help digestion. And so if it's trying to process something like high fatty foods, there can be this basically increased release of these enzymes, and that causes inflammation of the pancreas, which then can lead to inflammation of the gut, vomiting, diarrhea,
anorexia,
Yep, anorexia,
abdominal pain.
Yep. Oh yeah, it's really painful. It's always not fun. So the schnauzers or the breeds that are more prone to it, sometimes if they're having chronic flare-ups and we know it's a problem, we have to change them to a low-fat prescription diet because the over-the-counter fat content is just too much still for them. Some dogs are just super sensitive, but it can be like, I don't know if you want to speak to like the waxing and waning, because like,
Yeah, you can
like
get
it's a
those
lot.
cases where it comes and goes in those
Right.
breeds, and they seem to be, I think there's also a predisposition if they're like, if they have high triglycerides, like in general, like the schnauzers and those guys,
just,
then
fat. And,
fat, right? And so I think then those guys, if they're maintained on low fat foods, they have a tendency to do really well for, I mean, their lifespan.
yeah.
So most of the time it's an acute episode. And as long as we occasionally will get a situation where it can, basically those enzymes get released into the abdomen, and that is not good. When that happens,
Yep.
those patients are very, 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 very ill.
Sometimes they do require hospitalization, but I would say the majority is outpatient. We can just give them some
Conservative
meds.
therapy.
Yeah.
Yeah,
And
we just had Levi. Levi came in and he was with us for a few days for pancreatitis.
Yeah.
It's kind of
Levi
rough.
Pittman.
Mhm.
That's one of my favorite dogs of all
Yeah.
time.
Oh.
little white dog.
I mean, he's young. He's only like two,
Yeah.
right?
Oh.
He's awesome.
That's
I love
cool.
him.
I feel like you rarely say you have a favorite dog the whole time.
And you knew the last name. Nice.
Yeah.
Wow, I kind of want to like meet this dog. I feel like
He's just a cool dog. He's
Star.
like the perfect sized dog. He's like 30 pounds
Yeah.
and he's like a terrier cross kind of thing.
Yeah.
He's black and white and he has that kind of coarse hair and
Yeah.
he's just like
She's like, oh, I know exactly who he
he is. I have like a couple of favorite dogs. And
Yeah.
speaking of, anyway, he's really cool. So
He's hopefully feeling better. I think he's feeling better.
speaking of, we should give a shout out to Becky Shoemake, because they lost their dog of a long time, Keebler.
Oh.
And she watches the show, and her and Rick
Oh,
are just
I love
wonderful. I know.
Keebler.
And so she was old, but I mean, she did great for her. She had a lot of issues that she had to manage over time, but that dog lived much longer than I would have ever expected.
Yeah.
And that's
sent
because
a
they
lot
took
for
such
Yeah.
good
tech
care of her.
appointments.
Yeah.
Goodness.
So we're
Yeah.
thinking about you.
Shout out
Aw.
to Keebler.
It's
Shout out
always
to
the
Keebler.
at-home care, people,
Yeah.
if they really commit and do the right things.
They were amazing how they took care of her. They
Yeah.
did such an amazing job.
Oh,
They loved her so much.
I love old dogs.
I know.
Oh no, she's gonna.
She's gonna cry.
I won't.
Old people and old dogs.
Old people and old dogs. So cute.
Oh gosh. But anyway, so I had to say something
A-lister.
because they're listeners, and
Okay, shout out.
she was a great animal.
Yeah.
That's always
So
fun.
okay.
Okay.
There's a sad note, but
Oh, it was great.
Do we want to say something happy?
What do you mean? I hardly ever have any favorite dogs. I feel
don't
like I
know.
have like a favorite dog of every breed.
I've never seen.
I
you
feel
so
like-
excited.
I
about
know.
dogs
I feel
Levi
like you're just
Pittman.
excited about most things.
I have an
in life.
owner. Like, there's always an owner that has a dog of a breed that I'm like, your dog's amazing. I could have one of those
Yes.
dogs, and my dog would not be like that.
It's like the exception of the breed because
Yes.
they come with their own stereotypes.
yes.
We have our favorites too.
Yeah, see? Everybody has their favorites. I might just have met my favorite cat, which was Hunter Sidner.
Okay.
Sidner.
Oh, I just took a bunch of pictures of him. He just got neutered.
Oh my gosh. I did. I neutered him today. He is an orange male
Yeah.
Maine Coon. Oh my God.
Oh,
He's
Maine Coons
amazing.
are awesome.
He is so cool.
Oh my gosh.
So-
Duke DeLong is our favorite. Now I feel like we shouldn't be calling it.
I know, right? We're like, oh my gosh, well, what about? And then,
Perfect.
oh yeah.
And
oh,
Sully.
He's amazing.
Tanya Phils. Shout out to our girl. She asked a question one time.
Let's just do a shout out episode.
Shout out.
Yeah.
Oh, we should. That'd be
I'd like to
hilarious.
thank this
Shout out.
person for getting me here today and this person and this dog.
Yeah. It's always funny. So anyway, I always feel like there's always somebody like
People
that.
make an impact on our lives too. So
Oh,
do their animals.
Gosh, yeah.
We
Absolutely.
hope we make an impact on theirs.
I think we do.
Hope so.
I hope so.
All right. Well, thank
Next
you.
page.
Thank
Thank you guys for joining us today. We appreciate
Is
it.
it
Like,
time for
okay,
dinner?
hi.
Thank you so much, Phyllis, for joining us.
Thank you, Phyllis.
Thanks for tuning in to another episode of the Veterinary Table.
Round table.
The veterinary,
I always have to look.
the Veterinary Roundtable.
Yep.
Remember?
Oh, you want me to do this?
Sure, go
Oh,
for it.
okay. Remember, send in those questions and be sure to follow us on social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
I'm so used to looking at the TV. Thanks, everybody.